Good morning. Welcome to County Executive Stuart Pittman's weekly media call. Today we're streaming live on Facebook, so thank you for joining us there. My name is Roz Hamlet. I'm PIO for the County Executive, who is joining us on location from Maryland Live. We'll start with a report from him and be followed with a report from our health officer, Dr. Nilesh. County Executive.
Thank you, Roz. Yes, I am here at Maryland Live Casino, and the reason I am here is today is day one of a vaccination clinic here at the casino, and I've found myself making last-minute changes in my schedule to get to these vaccination sites. Yesterday, I was at Arundel Community College, and it's just a really wonderful place to be, to see the faces of people coming through, getting their vaccinations. And I want to talk, I have Anthony Ferenca here from the casino who's going to talk about why they've agreed to do this in a minute, but I want to talk about the process and how it is that Anne Arundel County made a decision last week, just hours before the governor's decision. So we were thrilled that the governor did the same, to move us into phase 1B. And that was important, especially because in phase 1B, we have our seniors 75 and over, those who are most vulnerable to the coronavirus. It also includes teachers and childcare professionals and congregate facility staff and residents. And so we are moving forward, and it has not been easy. What I want to say is that the decision was made on Thursday, which meant going to IT and getting a website set up, which is aacounty.org/COVID-vax, where people can register. And all of the vaccinations up to this point were done through employers because they were health workers and our first responders. And we did such a good job on that, particularly with our fire department doing all of our first responders for us, that we were able to move forward quickly and get this thing set up. And yesterday, Martin Luther King's birthday, nearly 1,000 were vaccinated at Anne Arundel Community College. The process of getting those people signed up in just a couple of days took staff, not only from the Department of Aging, but also our community engagement and constituent services class staff, as well as Office of Emergency Management, because folks not only were registering online, but a lot of them needed to call and talk to somebody, especially the seniors who maybe weren't going to get online and do this. And so they took 900 phone calls that averaged 10 to 15 minutes each to sign people up. And when I was out there yesterday, people were stopping me, telling me how wonderful it was to have somebody actually talk to them and help them through the process. So it's been a lot of work. I mean, you hear this story all around the country. Every county, every jurisdiction is working overtime, incredible hours that our health department staff has been working and putting the logistics together of signing folks up and getting these vaccinations done has just been a huge task, and everybody's participated. And I have with me Anthony Ferenca, from the general manager of Maryland Live, who has agreed to let this happen at the casino. And I want him to tell you why.
Good morning, everyone. Hello, my name is Anthony Ferenca. I am the general manager at Live Casino and Hotel. The safety of our team members and guests has always been our top priority. I can't tell you how proud we are and honored we are to host this incredible effort. I want to thank County Executive Stuart Pittman. I also want to thank Anne Arundel County for trusting us to be their business partner in this effort. Community support has always been a part of our DNA, and this is another example of that commitment. We want to thank everyone here on the call, and we look forward to helping the community continue to thrive. So thank you very much, and come see us at Live Casino and Hotel. Mr. Pittman?
Thank you. Thank you. And I'm not going in there because we don't want to give you a lot of pictures of people who are coming in and getting vaccinated without their permission, but it's a very large space, which is what makes it work here. And there's a lot of hall space for people to line up as well. But the line is not long because everybody's registered. Do not come here to get a vaccine if you're not registered. Please go to aacounty.org/COVID-vax, and that's how you get your appointment. And please be patient. There are hundreds of thousands of county residents that need to get vaccinated. And we have to do this in an organized and orderly way, and we have to wait our turn. But I'm just so thrilled that our county staff has come together and is making this happen. Everybody feels good about this work, and it's essential. The numbers, Dr. Kalyana will go over with you, but there is light at the end of this tunnel, and it's coming soon. Our holiday bump is over, so those numbers have come down, and we'll see whether they continue to come down or whether they level off. We don't expect them to go back up again. Hospitalization numbers are holding pretty steady, so while we do expect an increase there, we think those are going to drop soon as well as we get into February. And I am looking forward to the process of getting businesses back open, getting our restaurants back to 50%, getting this casino back to 50%, which I know they would appreciate, and getting our economy back going. But we have to time it just right. We have to do it responsibly, and we will. We're looking at those numbers, but it's coming just over the horizon. I also want to just mention that there are a few other things in addition to COVID going on. We still have to run county government and continue to do all the other work. I'm testifying on Thursday in the General Assembly on House Bill 319, which is called the Local Tax Relief for Working Families Act, which would allow local jurisdictions to tax at varied rates based on income. So it's a progressive tax proposal supported by the Maryland Association of Counties this year. And we look forward to having that flexibility in Anne Arundel County. I also want to note that Plan 2040, which is something, our general development plan for the next 20 years in our county, our Office of Planning and Zoning and thousands of our residents have been working on this for years, for the last 2 years in particular. And that goes to print at noon today, and it'll be on my desk by Friday. It will go to the next county council meeting, not tonight, but the first one in February, on February 1st. And in this time where we're told that we're divided, that we're politically divided, you look at this document and you realize that there's a whole lot that we do agree on. And when we're talking about the future that we all want for our families and how we want the land in Anne Arundel County to be used, there's a lot of common ground. And so that's a document that when it gets approved by the council, it will be an important day for Anne Arundel County. Budget season is here. We had our first budget town hall last week for District 4. And next week, we're going Monday, Wednesday, and Thursday for Districts 5, 7, and 1. Those are virtual this year, but please go to our website and look for the budget, and you'll see a budget tool and the schedule of all of our budget town halls and how to sign up for those. On the public safety front, we want to continue to remind people that there are no imminent threats of any violence related to the inauguration tomorrow that our police department has been told about. They have daily briefings from their federal partners, and they are working with state police, Annapolis police, and the federal partners as well, coordinating and are vigilant. Any tips can go to 1-800-492-8477 if anybody hears of anything that is any threats of violence that the police should know about. And finally, I want to note that today is a national commemoration of lives lost to COVID. We have crossed the 400,000 threshold in the United States. CDC numbers, the last I checked, were 401,700 deaths. Maryland, 6,476 deaths. And in Arundel County, we have, including the 14 who were never tested, 424. And it was just about 6 weeks ago that we lit the tree, the holiday tree in Glen Burnie, and held 5 minutes of silence for the 300 victims of COVID. So 124 in the last 6 weeks of our neighbors in Anne Arundel County. So we are not out of the woods. We need to continue to wear these masks, to maintain our social distance, to make the personal sacrifices to keep these numbers down. But please get vaccinated at aacounty.org/COVIDvax. And I will turn it over now to Dr. Kalyana with some of the latest numbers and his thoughts on the pandemic.
Thank you, County Executive. I will start with just where we are, our data, as I usually do, and then I'll show you a few slides just to show you the graphics on that. We're seeing that our case rate has come down. It's now at 48 from the high of 60, 63, 64. We believe that bump that we set, what we call that spike on that rise, was due to holiday season, those cases coming to bear. But we've seen this pattern before where we see a general upwards trend and then spikes on top of that. So we'll see where we head from here. 48 is still an extremely high case rate. So we're not complacent by any means at this point. We see that our hospitalizations have been fairly flat, a slight decrease of about 9 in the acute care census, but an increase in the ICU census of 4. And then our occupancy in the hospital is at 86%. For the ICU, it's 92%. I'm going to show you a few slides as well, just to give you some of that data. Give me 1 second. So this is our case rate that we're seeing. As I noted, we've seen these spikes before. Here's another one, but our general trend is upwards. So unless we see that really coming down, we're not out of the woods yet. As I mentioned, that our hospitalizations for the past week or so, and it remains to be seen what they're going to do. We've been talking about the fact that projections are for the peaks of the hospitalizations to be in late January, early February. So we're closing in on that time period, but we're not quite there yet. So still reason for caution. Our deaths, as the county executive noted, have been very high. And we typically see that the previous week's numbers are upwards as additional deaths are recorded. So that 14 is short a rise from the previous week. We had 26 deaths the week ending January 10th, which is the second highest deaths we've had in any week during this pandemic. And it's just a marker of the severity. As the county executive noted, we are at 424 deaths, including those who were not tested. And that's a tremendous loss of life. And there are many thousands more who have long-standing consequences of COVID during this pandemic, the long haulers. In terms of vaccinations, we've done total county residents over 20,000 at this point. The vast majority, 19,000, are first doses. The County Department of Health has done 9,000, a little over 9,000 doses at this point. We did 881 yesterday, and then we're, as county executive noted, we are opening our Maryland Live site. We sincerely thank Maryland Live for partnership on this and getting our county residents vaccinated. We'll be continuing with our Arundel Community College site. We are not providing vaccinations at Bay Meadow right now. They'll be coming back online in a week or two once we start doing second doses. We really did that just to decompress that site. Since we need 4 vaccination sites anyway, we wanted to get the Maryland Live site up and running. When we get out of this and continue with the rest of the points, give me 1 second. So I mentioned that we have the capacity to do 5,000 doses a week of first dose, and we will have the capacity to do 10,000 total doses, 5,000 first and 5,000 second doses. We are continuing the phase 1A healthcare workers vaccination, and we're doing that in partnership with Baltimore Washington Medical Center and Anne Arundel Medical Center. We've been talking to them about them doing healthcare workers from the community. We're of course now in phase 1B, and one of the reasons that we wanted to move there, and as the county executive mentioned, we were happy to see the state moving there as well, is that we were having to put more and more effort into getting those healthcare workers. And we know that with case rates being where they are, that poses significant risk of to people who are over the age of 75. We just talked about the issue we're having with just a massive number of deaths at this point. And so we want to vaccinate those who are the most vulnerable at this time. And that's people over 75. We're working with the Department of Aging, the community engagement in the county exec's office, OEM, and others to reach out to seniors to help them both through phone and website get registered for a vaccine. We put out our pre-registration site. And the reason we have a pre-registration site is that there's a lot of people who want to get the vaccine, and there's only a small number of people who are eligible based on the phase that we're in right now. But we want to capture their information, so when it's their phase, we're ready to send them an invitation. So since we launched this on Friday afternoon, and just many thanks to our OIT department for getting that done, we've had over 60,000 people pre-register, and 13,000 of those are 75 and up. And we've gotten invites out to those 13,000 people who are 75 years old and up. Just as a way to approximate our numbers, we estimate that there's over 40,000 people who are 75 or older. There's about 20,000 people who are in the other category in phase 1B, which is educators, and that is public school teachers and staff, non-public school teachers and staff, and childcare, about 20,000. So there's over 60,000 people in phase 1B, and we get 5,000 vaccines a week, and then the pharmacies are going to get a very small number. It's going to take the better part of 1.5 to 2 months to get through this group. So we ask everybody for their patience. We know that there are many people who need this vaccine, who can be protected by it. And that's why we're working through this phase system to be as equitable as we can in making sure that those are high risk, both of and of transmission, get it first. Do want to emphasize that once you get the vaccine, it's important to continue to mask, distance, and limit activity. The reason for that is that the vaccine works to either make it so that it's 95% efficacious, meaning that 95% of people either don't develop symptoms or have less severe symptoms. It does not mean you can't transmit it. In fact, we suspect that you can transmit it. And we're looking to see how the vaccine affects transmission. But right now, we should assume that even if you're vaccinated, you can still transmit it to others. So it's critical to continue the masking. The vaccine is really, really not a substitute for that yet until we get enough people vaccinated. The state is also providing vaccines to the federally qualified health centers. We have Bay Community in South County, Total Healthcare in Odenton, Chase Brexton in Glen Burnie. They're going to be getting vaccine and start vaccinating those who are 75 plus in their population. And we're reaching out to them to see how they're doing that. And we'd like to see that go out to additional practices in the county and the state to be able to support vaccinating that group. And the last thing I want to mention on vaccines right now is that we need everybody's help. We need people to be honest about what phase they're in. We're pretty much running on the honor system. We're finding that some people who are not eligible or at this time are saying that they are in an eligible category. I understand. I understand the desire to get the vaccine. I think we all do. But because it's a limited number, we really need people to be honest. That's the only way we're going to get through this together as a county. Our testing turnaround time is 2 days still. And it's going well. We're seeing good testing volumes throughout all of our clinics. About 4.6% of the population tested this week compared to 4.8 last week. Our percent positivities at 9.3% compared to 10.3% last week. So that's heading in the right direction. We are seeing some low volume at our pop-ups, so encourage people to come out for that. And I will just give a shout out to the health department staff who have been working a long number of hours to do this vaccine deployment. This is like nothing we've seen ever in terms of vaccine deployment. This, in terms of hours and effort, is very similar to what it was like in the springtime. when COVID first came to the county. And so I just want to extend a thanks to them for all of their hard work. And I will turn it back over to you, Roz.
Thank you, Dr. Nilesh. Next, we will hear from Mayor Gavin Buckley, who has a word about something that's special that's going on tonight in the city.
Hi, everybody. First of all, I want to say how grateful we are to your leadership during this time, County Executive Pittman and Dr. Nilesh. We have to not lose sight of the fact that we have just reached a mark where more people have died from COVID in our country than in World War II. And we know the greatest generation is the one that's been hardest hit by this pandemic. So tonight, I'll join with the county, the city. We'll be lighting up City Hall, coordinated with our federal partners to commemorate the lives that have been lost to this tragedy. And we must not forget the people that have been lost. We have to stay vigilant. We are nearly getting there, but we can't let up the pressure now. So thank you. Please come out of your house at 5:30 today, ring a bell, hold your heart, think about the people that we've lost, and we will get through this together. Thank you.
Thank you, Mayor Buckley. Turning now to our media questions, we'll get started with Olivia from the Capitol.
Good morning. Mr. County Executive, I'm wondering how you think the county's approach to vaccine distribution will change once Biden is inaugurated tomorrow.
I don't think anything will change right away. What the big question we all have is, what's the supply going to look like? So we have a plan in the county that we can expand, particularly as we hire another 120 people and we divert staff into this work from other departments. But our concern is that the supply won't meet our capacity to be able to deliver. So I know that the new president will be working to get as many vaccines manufactured and shipped as possible. But I don't think that he's going to be able to snap his fingers and make anything happen on that front in the very short term. So we're waiting and seeing on supply.
Thank you. One more question. I know that you were waiting until later in the game to get the vaccine yourself. I'm wondering if you have any sort of timeline or plan now that the county has moved into phase 1B. Not that you're in that group, but if you have a plan on when you're going to get it.
No, I've talked to other county executives about this very topic, and neither I nor any of them want to jump the line, but at the same time, we want to set an example that it's safe. And so haven't made any decisions on that. When I was at Arundel Community College yesterday, I ran into former Governor Paris Glendenning, who had just gotten vaccinated. He had signed up just like everybody else, 78 years old and proud of it. He's in his category and felt really good about that. But I feel like I ought to certainly wait my turn.
Thank you.
Going next to Amy Simpson from Fox 45. Amy? All right, let's go to Danielle from the Capitol.
Hi, this is Danielle Old, the Capitol. I'm on Olivia's line. I have a couple of questions, either for the county executive or the health officer, or both. My colleague reported the other day from the vaccination that was happening at the community college that folks with comorbidities could be vaccinated as well. Can anybody shed light on that? Because that's the first time I'm hearing it.
So I'll take that one. Can you just clarify the question exactly? When you say folks with comorbidities, Are you referring to people over the age of 75 or under the age of 75?
I'm not sure. I believe she was told at the vaccination site by a member of the health department that people with 3 or more comorbidities would be eligible in 1B. So
I'm not quite sure what that refers to, so I'd have to get back to you on that.
okay, all right. Then moving on from that, do either you or the county executive have any concern that, thus far I understand the prioritization of the vaccine rollout, but if you look at the numbers as far as who's getting vaccinated, the population thus far has been overwhelmingly white. And we know from the data that you've provided that the people who are dying disproportionately are Black residents, and the people who are being infected disproportionately, while yes, white members of the county, also those who identify as Latino or Hispanic.
So one of the things you're noting is actually due to the demographics of people who make up healthcare and first responders. And so that phase 1A group wasn't open to the general public, right? That was for first responders, healthcare workers, long-term care facility residents, specifically nursing home workers. And so that's leading to that demographic balance, I guess, or lack thereof, in terms of seeing a proportionally larger percentage of people who are vaccinated being white. That was a part of our thinking of moving forward into phase 1Bs precisely, and we noted that last week, is that Black residents do have a higher death rate, about 1.5 times, or a little more than 1.5 times the rate of their that you would expect. And so that's why it's really critical to get into this 1B category. And it's why we're, in addition to doing all our outreach, working specifically on our COVID health equity to specifically outreach to Black residents. We will be outreaching to Hispanic residents as well. They have not had the disproportionate deaths. And we also see from an age standpoint that they're disproportionately on the younger side of things. And so for our purposes of saving lives, it's going to be older Black residents at this point, 75 and really 65, because we're going to get there. It might take a month to get there, but we're going to get there.
Understood.
I noted the same thing when I was at community college yesterday, that the ratio by race seemed to be higher white than I think the county ratios are. And from the beginning, Dr. Kellyanne Rahman put together the COVID health equity task force that had 100 people at the beginning, and I think it's smaller now, but it continues to meet. And we're all well aware from a marketing perspective as well that we have to do some hard work to get the word out in minority communities, particularly in African-American communities, where trust in medicine is lower. We are in Arundel County, where Crownsville Hospital Center was doing experiments on African-American people that were immoral. And so when trust is low, we have to rebuild that trust in the science and in the medicine and in this vaccine. So we're going to be working with leaders in the African-American community to do just that, and marketing extensively to get those folks vaccinated.
Understood. And quick, one last thing. I can't remember if it was the county executive or the health officer that mentioned people were signing up and showing up for vaccines that were not yet eligible for them. How are you vetting people? I guess, how did you find that out?
So I mentioned that. We find that out in a couple of different ways. So healthcare workers is probably the biggest category. We saw that up until today, right? We just started 75. People either coming without IDs, and we're not being rigorous about that. We've always said we're really not looking to enforce regulations. We just want people to be forthcoming about their status. But we're also seeing people who are much younger, people who will tell us that they got the email link from a friend or family member and are coming. So people have been fairly open about that. And it puts us in a challenging position. As much as we want to get vaccines into arms, we also have to be equitable about that, right? We all we all want to know that the process is fair. And so that's why we're really asking people to just keep in mind that we're trying to be equitable across the county.
Do those folks that show up and are clearly not in one of the eligible categories get turned away?
Generally, if we know about it and it's pretty egregious, yeah, we do turn them away. But we don't really like to do that because everybody could benefit from the vaccine. So our huge ask is to please don't put us in that position.
Thank you very much.
Amy Simpson, Fox 45, want to try again? Amy appears to be having some trouble with her mic, so let's go to the next question. Who's next?
I mean, I have more questions, but I don't want to make this the Capitol show. If no one else has a question, I got a number of emails from folks over the weekend who were asking how will they know when they can get their second dose, and will it be the same, I guess, brand, Moderna or Pfizer, that their first dose was?
So anybody who gets their first dose, we have your email and phone number to contact you for the second dose. So you will get that notification. And it will be the same. The second dose will be the same as the first one. If you got Pfizer the first time, you have to get Pfizer the second time. If you got Moderna the first time, you have to get Moderna the second time. And because we're one of the few counties who are doing both those vaccines, that logistics coordination is a bit more difficult, both in matching the vaccine type and in managing the different lengths, 3 weeks for Pfizer, 4 weeks for Moderna, from first to second dose.
Thanks.
Most counties are not taking the Pfizer. Most county health departments are not taking the Pfizer because of those logistical challenges.
Dr. Kalyana, this is Olivia from the Capitol. I think you got your first dose like the week before New Year's. Are you coming up on your second dose? Do you have that scheduled already?
Yeah, it's coming up on the 27th actually, and that reminds me I should probably check on the timing for that. So.
Great, thank you.
Okay, Amy would like to know what is being done to ensure adequate staffing for vaccine distribution.
So in terms of staff, we have been, from the health department side, we've been working to pull our remaining school health staff and some of our disease prevention staff. That's not going to be enough, and we expect our school health staff to go back to school at some point. So we're also hiring 120 new people to carry out this vaccination effort. We've been working with the fire department, and they've been a critical partner in delivering vaccines. They did that for the first responders, and we're working with them on the public school vaccine administration. We've been partnering with the hospitals. As I mentioned, this weekend they opened up to healthcare workers from outside of the department. But we've also been talking with in-county government of a plan to be able to pull people from throughout the government, and I thank the CE on this one. In case we see a surge in vaccines or a drop in our staffing because of a return to school a little faster than we anticipate, being able to draw from county government, and then also working with volunteer groups to figure out a way to have volunteers be a part of this effort as well. So we've got a lot of different avenues that both are in place and are being explored.